Welcome to my scientifically informed insider look at mental health topics. If you find this video to be interesting or helpful, please like it and subscribe to my channel. Hello, this is Dr. Grande. Today's question asks if I can take a look at a presentation example that examines a failed treatment attempt when treating somebody with Narcissistic Personality Disorder. I'll refer to this disorder as NPD. So a presentation example, which is also called a case study, clinical vignette, a case analysis, is when a clinician records information from a case in a case report and analyzes one or more aspects of the case. It's done with the client's consent and for educational purposes, and of course information is changed to protect confidentiality, although in theory the clinical essence of the case remains intact. Now, personality disorders are notoriously difficult to treat in mental health counseling settings. One of the most difficult personality disorders to treat, if not the most difficult, is NPD. This is a cluster B personality disorder, so it's in the same cluster as antisocial, borderline, and histrionic personality disorders. This is called the dramatic, erratic, and emotional cluster. NPD can be challenging to treat for a number of reasons, but some of the most common would be a lack of insight, no true willingness or desire to change, so a lack of motivation, a lack of knowledge about narcissism on the part of the counselor, and mental health counselors sometimes struggle to deal with the continual insults and arrogant behaviors of the client directed toward them. Now, of course, this last part shouldn't be a factor. The counselor should be professional enough to separate the client's behavior, and normally it isn't a factor for an experienced counselor. But counselors are human just like anybody else, and in particular, new counselors sometimes let their emotional reactions get the best of them. One of the many reasons why clinical supervision is so important. So moving on with the case study, this is an interesting case study. This is a clinical vignette that was put forth as an example of a counselor, who I will call Christy, failing to treat NPD. Although I don't think the treatment was a complete failure, it did demonstrate the counselor's lack of knowledge on narcissism and personality disorders in general, highlighting one of those key challenges that I talked about before. What I really liked in this clinical vignette was the willingness to assemble this kind of report in the first place, learning from a situation where things really didn't go as expected. Many of the case studies that we see feature these moments of genius by the counselor and textbook presentations of symptoms that fit neatly into diagnostic categories. For example, a classic case of major depressive disorder or a typical case of obsessive compulsive disorder. I like the clinical vignettes where things didn't go as planned, when the presentation wasn't clear diagnostically, and when the counselor had an opportunity to learn from mistakes. In this case analysis, we don't see a thorough history taken by Christy. This wasn't an oversight, but rather a function of the theoretical modality that Christy had been trained in. She was using a brief form of cognitive behavioral therapy, CBT. And in this version of the modality, there was no emphasis on history, including early history, like childhood events, for example. Rather, a focus on what's going on in the moment and definitive cognitive strategies. So giving strategies to the client that the client can then go use in their own environment. For example, like applying adaptive responses when confronted with negative automatic thoughts. Christy, the counselor, was relatively new to the field. She was in her mid-30s and had limited experience working with personality disorders. Now, just because we have a lack of a thorough history doesn't mean that we have no history. We know that the client, who I will refer to as Steve, was an unmarried Caucasian male in his early 40s. He had some history of substance use and criminality, including a short stay in jail. Steve had been married twice before and divorced both times. He had 2 children from the first marriage that he did not see anymore. Steve worked for a mid-sized company that did improvements on residential and commercial buildings, like construction type work. It wasn't really specified, but I'm guessing something like replacing windows, siding, maybe doing carpentry work and flooring, things like that. He used to be a skilled laborer for that company, but eventually was moved to sales, which he considered to be a promotion. It sounded like he still did some of the work after he bid on a job and got the job. So he would go and visit a potential customer, look at the work that needed to be done or the work that they wanted to be done, give them a quote or an estimate for the job, and then actually do some of the work along with the crew of workers that would come out to the residence or the commercial building. There were several people at the same business that did the same type of job that Steve did, so sales and then helping with the work. Most months, Steve was the most successful in terms of the number of deals they closed, but also in terms of making the most profit. He was able to convince customers to agree to quotes that were substantially higher than the other salespeople could get. He had fairly good product knowledge from all his experience as a skilled laborer, but it sounds like his edge was really in his confidence. Customers believed that he was accurately representing the value of whatever work the company did, and that he was accurately representing the downside of failing to have the work done. So maybe he was using some scare tactics here as well. I've seen this a few times with expensive product or service sales. Highly confident, some would say even narcissistic salespeople, can be highly convincing in a situation where a customer feels under stress about whatever it is they're looking to buy. So he was kind of a high-pressure salesperson. He used his ability to manipulate people to be successful financially. So what brought Steve into therapy? Well, even though Steve had more sales and more profitable sales, he also drew the most complaints. Customers would describe him as condescending, arrogant, dismissive, and he would get offended and assertive if somebody criticized his work or the value of his work. His coworkers didn't get along with him too well either. So it sounds like the more the customers got to know Steve, like when he was on the site helping the other people do the work, the less they liked him. This is the so-called Narcissistic Personality Disorder attraction curve. People with NPD have superficial charm, which means they're very effective at charming people, so long as that relationship doesn't continue long enough for the people to really get to know the narcissist. So there's this point early on when knowing a narcissist that they can be really attractive, but that diminishes quickly. That level of attraction drops off very quickly and goes down very far. So that superficial charm gives a narcissist kind of a narrow window to make a good impression and to accomplish whatever it is they wanted to accomplish. So Steve's employer suggested that Steve go to counseling. His employer asked him to work out his anger issues. At that point, the term narcissism wasn't brought up. Steve came in to see Christy, explained that his employer thought that he was an angry jerk, and they wanted Christy to change him from being a jerk to a normal person, right? This is the language he used. So two interesting things here. Using the word jerk, referring to himself as a jerk, when the employer just wanted him to tone down the anger, and the way he said it made it seem like a bad transformation. So he would have to go from being whatever he was back to just being normal. Christy came up with a fairly straightforward plan, again based on brief CBT, this version of brief CBT that she was using. She wanted Steve to make a few definitive changes. And a lot of these actually sound like fairly good ideas in many situations when working with somebody with NPD. She wanted Steve to recognize his weaknesses, to assume that other people may be correct about whatever he was talking with those people about, to listen more and to talk less, to pay compliments to other people, and to share the credit when he's working with somebody else on a project. Every time an automatic thought came up that moved him toward a behavior that he should avoid, he was supposed to apply what's called an adaptive response, so self-talk, a statement that counteracts the automatic thought. For example, if Steve has a thought that his work is perfect, therefore no one should be able to criticize him, he can use the adaptive response like, my work is good, but other people have a different perception. I can learn something by hearing them out. So kind of a good example of an automatic thought that's not useful and self-talk that may be useful. Christy and Steve worked out, collaboratively, a number of adaptive responses for many of the automatic thoughts that Steve was able to identify in session. Christy had Steve write the adaptive responses down, I imagine on something like index cards, which is a fairly popular technique, so he has those self-talk statements available when he needs them. So it sounds like everything was mostly going according to plan. Steve came into treatment, he talked about some thoughts he was having that may be contributing to his difficulties at work, and they worked out a plan to address his concerns. So here's where the problem started, and I've seen this a number of times working with narcissistic personality disorder. Instead of applying the adaptive response as written and taking appropriate action based on that self-talk statement, Steve greatly exaggerated each of the behavioral strategies that Christy suggested to him. So with recognizing weaknesses, Steve told everybody that he was an idiot and he really wasn't good at what he did. He said that his years of experience in the field apparently didn't pay off. So a little more than a hint of sarcasm. In terms of assuming that other people may be correct, when people suggested that he do something different, like his work in a different way, He always took their advice, which led to the incorrect installation of different items in homes. In terms of listening more and talking less, Steve didn't hardly talk at all. Interestingly, his coworkers were okay with this change. All right. So in terms of paying compliments, he told everybody they did a good job when clearly they made a mistake. So again, he was essentially being sarcastic. And in terms of sharing credit, instead of sharing credit, he gave 100% of the credit to everybody else. He described himself as a worthless accessory. He really wasn't needed as part of the process. Christy described Steve's reaction as a temper tantrum, and it certainly had some similarities with one. There was an immaturity component here. But there was also a resistance component, an unwillingness to cooperate with therapeutic goals. Steve believed that if he exaggerated all these behaviors, it would prove his point, that he was perfect the way he was and no one should be telling him to change. So he never really bought into the therapy. He never tried to do it the way it was designed. It was supposed to be a moderation of behavior, not an extreme change. So here's what's really interesting about the outcome of this case. With these new behaviors that Steve was trying, again, he was exaggerating the behaviors. They weren't really the behaviors that were recommended. His sales went down, his percentage of closed deals was smaller, and his profit margins went down. He was conceding a lot in the negotiation process, not sticking to his position that the services that he sold were valuable or necessary. He wasn't demonstrating confidence. At the same time, with a few exceptions like doing the work incorrectly because the customer suggested he do it that way, Steve's complaints dropped off significantly. Everyone seemed to like him much better now. In a sense, this therapy really wasn't a complete failure. It was partially a failure, but partially a success. There really wasn't a change in attitude, but there was a dramatic change in behavior, which actually makes a lot of sense because personality is difficult to change, but behaviors can change, and sometimes they can change fairly easily. How did the therapy terminate? What was the outcome here with this clinical vignette? Well, Christy ended the therapy on schedule, 12 weeks of therapy. Even though she did not take a detailed history, near the end of therapy, Steve informed her that he had been in a similar situation, not the counseling part, but the accusations of being condescending and angry, as well as his subsequent overreaction and exaggerated changes. Information that would have been useful if Christy collected it toward the beginning of therapy, but again, no detailed history was taken. Steve ended up leaving the company and going to a competitor. He wanted to be at a place where he could be himself, go back to using his successful sales strategy. He was afraid if he stayed at the company that sent him to therapy, they would make him go back to being a skilled laborer and not let him do sales anymore. This caused a fear of going back to normal, as he put it, something he was not willing to do. So what lessons can we learn from this case study? Well, the first one would be that motivation is a key part of change. It's important to have buy-in when suggesting cognitive or behavioral change strategies. The second lesson would be that insight is important as well. It's difficult sometimes for narcissists to see themselves as narcissistic. Instead, they see themselves as superior. So their mentality would be something like, there's no sense fixing something that is not broken. Third lesson here would be when you change from appearing narcissistic to appearing non-narcissistic, which is really what happened here because there was no real change in personality or cognition, you lose any potential adaptive characteristics of narcissism, like high self-confidence and the ability to be convincing. I don't think manipulating people to hand over money is actually adaptive, but for some people, they may see it that way. And then the fourth lesson learned here would be brief strategies are interesting, and I think they have a place in counseling, but if you're skipping the detailed history, you're taking a chance of missing something important. Taking a thorough history can seem like a waste of time in certain situations, but actually it can save you a lot of time. It can make you more effective as a counselor. So I know whenever I talk about case studies, including those involving narcissistic personality disorder, there will be a variety of opinions. Please put any opinions and thoughts in the comments section. They always generate a really interesting dialogue. As always, I hope you found this case study on NPD to be interesting. Thanks for watching.